Hi and welcome to this new topic about potential therapeutic utility of cannabinoid compounds in liver disease. In this topic, we're going to talk about involvement of the cannabinoid system in the liver physiological functions, how change different components of the system in liver disease, and how we can modulate some pathological aspects related with liver disease, modulating this cannabinoid CB1 and CB2 receptors pharmacologically. First of all, it is important to mention that both endocannabinoid receptors, CB1 and CB2, are strongly involved in liver functions. CB1 is involved in liver glucose level, in glucogenolysis, lipogenesis, insulin resistance, etc. And CB2 receptor is more involved in insulin sensitivity and lipid accumulation. In presence of a liver injury, there is important increase of different endogenous cannabinoid ligands, such as anandamide or 2-AG. And also, both of them are expressed in the liver. However, in physiological conditions, they are rapidly degraded by these enzymes, FA and MAGL, which indicates that there are higher abundance of these enzymes in the liver. In presence of a liver injury, and focusing firstly our attention on cannabinoid receptor CB1, this receptor is expressed in the hepatocytes, as you can see here, also in myofibroblasts and in the endothelial cells. In presence of a liver injury, the expression of the receptor is increased, and this increase induces hepatocyte proliferation. And also, this increase is involved in the steatosis, in the fibrogenesis, and hepatocyte apoptosis. Therefore, the activation of cannabinoid receptor CB1 induces fibrogenic-like effects. Regarding cannabinoid receptor CB2, which is expressed in the Kupffer cells and also in hepatic myofibroblasts, the activation of the receptor presents more anti-inflammatory effects. There is a reduction of steatosis, there is a reduction of hepatocyte apoptosis, a reduction of fibrogenesis, and increase of hepatocyte proliferation. Therefore, activating cannabinoid receptor CB2 could have important protective effects at this level. Now, regarding the involvement of both of these receptors in liver disease, or of the modulation of these receptors in different models of liver disease, several preclinical studies have been carried out. Here we have the first one, where the effect of this compound, rimonabant, which is a CB1 receptor antagonist, is evaluated in a model of a liver disease induced by hepatic ischemia during 30 minutes, and after that a reperfusion for 6 hours. Here, in the first part, authors evaluated the effect of this liver injury on different enzymes related with hepatic normal function, which are ALT or AST, and also on bilirubin levels. They found that the model of hepatic ischemia induces an important increase of these enzymes, which means that there is important injury at this level, that CB1 antagonism is able to modulate or normalize this enzymes level. Additionally, authors evaluated the expression of not only cannabinoid receptor CB1 and how it changes on the different experimental conditions, but also all the proteins and phosphorylated and non-phosphorylated proteins involved in CB1 signaling pathway. They found that this pathway is strongly affected in the model of liver injury. As you can see here, there is an important increase of all these markers and the significant reduction of cyclic AMP. And rimonabant administration or the antagonism of CB1 receptor was able to completely normalize all these molecular changes. To further explore the presence of autophagy or autophagy regions in the liver of these rodents, authors analyzed or did immunohistochemical studies for both of these markers, which are markers of autophagy, and this marker P62, which mark a final autophagosome degradation. They found that there is a reduction of autophagy markers of both of them in the model of liver disease. And the rimonabant administration achieved complete normalization of both of these markers. Similarly, the final autophagosome degradation is significantly increased in the model of the disease, and there is a modulation after the administration of rimonabant. So authors conclude that the blocking cannabinoid receptor CB1, they are modulating not only signaling pathway involved in this receptor mechanism, but also autophagy and different factors involved at the pathological level in the liver injury. So CB1 antagonist was able to reduce the autophagy and prevent ischemia-induced oxidative stress, inflammation, and liver injury. Following with the pharmacological modulation of cannabinoid receptor CB1, in this new study, a new compound, which is a hybrid inhibitor of CB1 and nitridoxy synthase enzymes, was evaluated to analyze its effects on different markers associated with liver fibrosis. This new compound, which is MRI-1867, in the first part, authors evaluated its pharmacokinetic properties after its acute and chronic administration. They found that its presence, this compound, present a higher specificity by its accumulation in the liver at both doses that authors use for this part of the study, and that is not able to cross the blood-brain barrier, not mainly because they are very low concentration or very low percentage of the dose achieve the brain tissue after acute or chronic administration. So in the first part of the study, authors aim to evaluate if the administration of this compound could induce some behavioral effects, because the blocking of cannabinoid receptor CB1 has been associated with important emotional alterations. Here they compare this MRI-1867 with rimonabant, which is CB1 antagonist, after its acute or chronic administration. This is the elevated plasmase test, when the time in the open arms is evaluated as a measure of anxiety-like behaviors. Here, rimonabant presents significant decrease of this time, so it means that there is an important anxiogenic effect of this compound after its acute and chronic administration. However, this MRI compound didn't induce any change or any modulation of this time in open arms compared with controls at 3, 10, or 30 milligram per kilo weight. This happens after its acute administration, but something similar happens after the chronic administration of this compound. So MRI 1867 did not modify anxiety in rodents after both of these two types of administrations. After this first characterization, authors decide to analyze the potential usefulness of this compound in a model of biliary fibrosis induced by bile duplication model. They use for that three types of mice. The first one is the wild-type mice, the second one is CB1 knockout mice, and the third one is NO2 knockout mice. To further explore the involvement of each of these receptors in the mechanism of action of this compound. After 2-week subchronic treatment with vagal, rimonabant, or MRI, authors evaluated the fibrotic area in all these experimental conditions, comparing injured liver versus control, or rimonabant MRI versus injured rodents treated with vagal. Authors found that there is important increase in the fibrotic area in all three genotypes of mice, as you can see here, in wild type, in CB1 knockout and NO2 knockout mice. Interestingly, the administration of rimonabant modulate just a little bit this effect in wild type and also in the third group of mice. However, comparing with rimonabant effects, MRI was able to induce higher modulation of this fibrotic area in wild-type mice and CB1 knockout mice, but not in those two knockout mice, pointing out that this receptor could be the most involved in these anti-fibrogenic effects of the compound. Authors also decide to analyze if these effects induced by MRI could be associated with some anti-inflammatory actions. For that, they measure these proteins, NLRP3 and ASC3. In controls in rodents exposed to this liver injury and treated with vagal, rimonabant, MRI. They found that there is an important liver inflammation associated with the model, as you can see here, because all the parameters are significantly increased in wild type, in CB1 knockout, and in NO2 knockout mice. The administration of rimonabant did not induce any modulation of these pro-inflammatory markers. Interestingly, the MRI 1867 was able to modulate significantly all of these markers in wild type and CB1 knockout mice, but not in NO2 knockout mice. Furthermore, it should be known that both drugs have an important effect on macrophage activation on apoptosis at the liver level. Firstly, regarding the activated macrophages, authors evaluated that there is an important increase in the model of liver injury. This increase was modulated after rimonabant, but this modulation was higher after MRI 1867 administration. And similarly, there is an increase of apoptotic cells. This increase was significantly modulated only after MRI administration. Regarding this compound, which is cytokine, related with macrophage infiltration in the tissue. As you can see here in these figures, there is an increase of macrophage infiltration in all of three genotypes of mice. This increase was significantly modulated with MRI 1867 in wild-type mice, in CB1 knockout mice, but not in those two knockout mice, pointing out once again the involvement or the highest involvement of this receptor in MR1867 mechanism of action. So, as data observed so far refers to results obtained when the drug is administered after the liver injury. However, to evaluate the effectiveness of this compound when the injury is induced, authors carry out additional studies. Here they did this they induced this liver injury, and starting at day 6, they started with the administration of rimonabant, this compound MR1867, this other 14-OOW, which is specific NOS inhibitor. They found that there is an increase in the fibrotic area at day 6 of the injury, but this increase is significantly higher at day 14, and that all of 3 drugs were able to modulate or to reduce this area. However, interestingly, this reduction was higher with this compound, which acts on blocking both receptors, CB1 and NOS enzyme. Another way to induce liver disease or liver injury, is by chemical manipulation with the administration of carbon chloride that we have here. So authors did additional experiments to evaluate if in this type of liver injury, MR1867 is also able to modulate fibrotic areas and all the biological markers associated with this injury. So they administered this compound twice a day during 4 weeks. After that, at the same time, the rimonabant and MRI-1867. After that, they evaluated or measured the fibrotic area, and they analyzed also gene expression of different profibrotic markers associated with this liver injury. Here, both fibrotic area and this profibrotic gene expression, profibrotic markers gene expression were increased after the liver injury induction. This increase was significantly modulated with the rimonabant. However, this modulation was higher after the administration of this dual inhibitor. Liver injury is often associated with metabolic changes and obesity. So, to assess the ability of this compound in modulating also these alterations associated with liver damage, authors analyze more variables related to the weight, hepatic triglyceride, glucose levels after glucose administration, and they found that in the case of the model, the weight, they didn't find any alteration in the weight of mice exposed to a liver injury compared with controls. However, the administration of this MRI achieved dose-dependently a reduction of the body weight after almost 7 days of treatment. Regarding hepatic or liver triglyceride levels, there is an important increase of triglycerides in the model of injury. This increase was significantly normalized with the highest doses of MRI-1867. Similarly, glucose metabolism was significantly altered in rodents exposed to the model compared with controls. In the administration of MR1867, achieved normalization of these glucose level alterations with values very similar to those observed in controls. So authors conclude that this compound was not only able to modulate all the molecular and histopathological markers associated with liver injury, an injury induced by different type of experimental procedures. And however, it also was able to modulate metabolic alterations associated with this injury. So this compound could be an important and interesting therapeutic strategy for its further exploration. Now, regarding the cannabinoid receptor CB2, in this study, authors aimed to evaluate if the agonism of this compound is able to modulate the inflammation, the progress of hepatic fibrosis induced by this compound, diocetamide, administered for a period of 3 weeks. Here, they in the first part of the study, they analyzed different markers associated with oxidative stress, such as MDA, glutathione, and superoxide dismutase. They found that all these markers were significantly altered in the TAA exposed group, and these alterations were significantly modulated dose-dependently with the CB1 receptor agonist. Additionally, evaluating inflammatory markers, authors found that there is an important increase in TAA group of these markers, and this increase of interleukin-1 beta-6 and TNF-alpha was modulated, significantly modulated, and dose-dependently with the CB2 receptor agonist. And similarly, both of these markers, which are involved in liver fibrosis, were also altered in TAA group, and this alteration tends to be normalized in rodents treated with the highest dose of this AM1241. At the histopathological level, authors observed important fibrotic regions in green, as you can see here, and also in black apoptosis in rodents exposed to this compound. After the administration of, exposed to TAA, after the administration of AM1241, there is important improvement of both of these markers. They are not of most fibrotic regions nor apoptosis, and these histopathological images are very similar to those observed in control. So this compound was also able to modulate these markers associated with liver injury. The same regarding the necroinflammatory activity score. There is also an important necrotic, there is an increase, or there is a significant alteration of all of these markers in the TAA group, as you can see here, compared with controls where the score is 0, obviously, and this increase was completely normalized with both doses of this compound. To further explore the effect of this compound in the fibrosis induced by TAA administration, here we have more additional histopathological studies. As you can see here, we have important fibrotic areas in TAA exposed group, and these areas are significantly reduced with the AM1241 administration at both doses, 3 and 6 milligrams per kilo of weight. So authors conclude that the CB2 receptor agonist was able to modulate different oxidative, inflammatory, and histopathological markers associated with this model of a liver injury. To further explore the involvement of this cannabinoid receptor CB2, authors carry out this bioduplication in rats during 35-42 days, and after that they administered SAE, which is CB1 agonist. This compound, which is CB1, CB2 agonist, and AN-C30, which is CB2 antagonist. The aim of this study was to analyze not only the involvement of CB1 or CB2 receptors in liver injury, but also in the angiogenesis in this model of liver disease. Regarding the different markers, in the first part, authors evaluated the hemodynamic aspects related with liver injury, which is the shunting as we have that we have here. They found that rodents exposed to they found that only the cannabinoid receptor CB2 agonism, this compound, was able to reduce these shunting levels in mice exposed to this model of liver injury, alleviating so the circulatory load in these rodents. In addition, using different microscopic techniques, our authors evaluated vascular aspects related with the disease and with the administration of all these compounds. As you can see here, they measured vascular length, vascular area, and other important aspects related with vascular markers of the liver. They found that the exposure to the model induces an important increase. Here we have vehicle-treated rats. And this increase was modulated only after the administration of CB2 receptor agonist. And here, when they compare only vehicle and these agonist exposed rodents, they found significant reduction of both markers, vascular length and vascular area. Authors also evaluated different markers associated with vascular endothelial growth factor. We have it here, the gene expression of this target and also its receptors, to further explore the vascular effect, the molecular mechanism that could underlie the vascular effects of this CB2 agonism, and also other markers more associated with oxidative stress. They found that the administration of CB2 receptor agonist reduces significantly the gene expression of the receptors 2 of the EGF, vascular endothelial growth factor, and also only this compound reduces COX-1, COX-2 gene expression and eNOS gene expression. However, here in the third part, this decrease was not statistically significant. These changes were associated with a reduction of the number of blood vessels and fibrotic areas in the liver with CB2 agonist drug, as you can see here. Here we have the SEA, which is CB1 receptor agonist. And when we compare the effect of vehicle-exposed rodents versus those treated with CB1 or CB2 receptor agonist, the effect of on the vascular count and fibrotic area is very clear. CB1 receptor agonism, as we saw in the beginning of this session, induces an increase in the fibrogenic processes. This aspect is also observed here, as you can see in this graph. However, CB2 receptor agonism reduces both vascular count and also fibrotic areas. So, to finish this this part of the endocannabinoid system as a therapeutic target in liver disease, we saw that the CB1 receptor antagonist could have an important and very interesting, could be an important, very interesting therapeutic strategy for its ability to modulate hepatic markers associated with liver injury. However, regarding rimonabant, for example, it can induce important emotional alterations, so more CB1 antagonists without the ability to cross the blood-brain barrier are necessary to modulate all the neuropathological and biological markers associated with liver disease. Regarding the cannabinoid receptor CB2, the agonism of the receptor demonstrated to have an important anti-inflammatory, anti-oxidative, and antifibrogenic effects. So both receptors could act as therapeutic targets for the development of new effective strategies for the treatment of different aspects related with liver disease.